And so again, Michelle Cotterman, registered nurse, is actually coming on today to give us an update on the Health Freedom Ohio initiative. And I think here she comes. Hi, Michelle.
Okay.
Can you hear me?
Yes, I can. How are you, Jason?
Excellent, excellent. We'll do a few minutes here. We're not going to do a full-blown 30-minute interview, but I want to get some updates from you because I know you posted an interview, or actually, I'm sorry, a talk a couple days ago on your Facebook page. We have a bunch of people watching right now. And so I want you to dive right into this. This is about what you're doing in Ohio with Health Freedom Initiative. Give us some background and some updates on what's actually happening in your world up here in Ohio.
So we have finally gotten our nonprofit organization off the ground and running. It is Health Freedom Ohio. And our purpose, intention, and goal is to raise awareness about alternative pathways to health and wellness, and also connect providers and consumers who are looking for those modalities to the people who are practicing the modalities. But most importantly, I think, is the legislative action that we look to protect our consumer choice in the state of Ohio so that we continue to have access to those alternative modalities.
That's huge. And so this is, I mean, this is basically, as they call it, the grassroots effect, right? Whereas you're literally out there talking to people every single day. Give people some feedback on how you're actually hitting the ground, who you're talking to, who you're getting in front of, and where this actually goes.
Sure. Well, we have launched a new fundraiser campaign. We want to start annual wellness days at the Capitol. So we want to get our people in the natural health community in front of the legislators, and we want to be able to have those conversations with them and to raise awareness about natural pathways to health, because they have pharmaceutical and medical trade organization lobbies in their ear all day long, every day of session. So we in the natural health community need to step up our game and start getting in their ears as well. And that's where Health Freedom Ohio looks to become the natural health voice in the state of Ohio. And it is absolutely grassroots. Our funding isn't coming from pharmaceutical companies. This is 100% people-based, community-based support. If you're using natural remedies, natural modalities, if you want to share your stories, we have a blog. I would love to get a blog up and running, like Becoming the Proof, where people share their stories of recovery from, you know, where they were from an allopathic standpoint and treatment to where they abandoned that and used natural remedies, whether it was food, homeopathy, herbal medicine. We would love to share those stories so that they can empower others to become the proof. So this is 100% us, you guys. Ohio, we need to have a natural health voice, and it is now or never.
Yeah, and you said you're talking about the lobbyists, the people you're dealing with. So you're actually going right into government. You're talking to people that are really, I say important, but people who are in a position where they can actually make decisions. And you're kind of going in there, and this is grassroots, because you're trying to beat an industry that is completely run by millions, if not billions of dollars from the pharmaceutical industry. And just give people a little background again on how you even got involved in this. I know you've been on the show before, but not everyone's been seeing that. So just give a little background on how you got involved in this, because you are a registered nurse. So I said in a previous interview, you have the best of both worlds. You've seen the medical system and how much things can get really crazy, but you've also seen the natural health world and how people can heal.
Yes, I was raised 100% in an allopathic mentality. My grandfather was a medical doctor. As kids, we were raised with pharmaceutical products only. And it wasn't until my daughter had an allergic reaction to a round of vaccines that I started reading about vaccinations. And that is what opened the door for me, essentially, because when my son was born and the pediatrician wanted to talk about the vaccine series he was going to get, this was when he was only 2 weeks old, I said no, and they fired us as patients right on the spot. So that led me to find a medical doctor who was open to us as unique individuals, as individual patients who come with our own set of beliefs and concerns. And she opened the door to homeopathy, herbal medicine, healing touch, color lamp therapy, you name it. And I was alone at that time. I didn't have any friends who were doing things differently. I was not connected with the natural health community. And Robert Scott Bell, I found his show And his show really empowered me and gave me the strength and courage to know that I wasn't alone. There was this whole community out there. And then it wasn't long after that that I became connected in with the natural health community in the state of Ohio. So I spent the last 2 years doing advocacy work on the vaccination issues. That developed relationships with state representatives and state senators. And I realized at that time that, you know, we're not represented at all down there. There's no lobby for us. I mean, they hear nothing. All they hear are the scary statistics that these organizations love to put out there. So, you know, it's just so important that we get vocalized and start our own advocacy group and lobbies.
Absolutely. And I want to add something too, because we chatted a little bit last night. We were going to try to do this last night, but some of the technology wasn't working. But we chatted, and you went over a survey with me last night that was kind of mind-blowing. I'm not going to give the number because I want you to be able to give it to them. But there was this survey done, or kind of questionnaire done, study done, where it showed how much people actually thought they were in control or in partnership with their physician on healthcare. And that number was, so take people through that really quick, because I think that's very eye-opening, and describe what this survey or study was so everyone knows.
Sure. So the Pediatric Ohio Hospital Association commissioned a report, the first of its kind in the state of Ohio, where they wanted to analyze the health outcomes of the youth in the state of Ohio. And the report is linked on a post on our Facebook page at Health Freedom Ohio. And we took some screenshots of the statistics and data that really jumped out to us. Basically, what they found is that we are absolutely failing at health. Ohio is in the lowest 46 out of 50 states. We're number 46 in our health outcomes. But what's worse is that people spend the most on their healthcare in the state of Ohio and have the worst health outcomes. So it tells me that it's not about having access to horrible care. It's about empowering an individual. And that's what the natural health community is all about, is empowering you to take charge of your own healthcare. And that is when you see people start to thrive, and not just survive, but thrive. So, you know, the natural health community has no voice at the table of these people that are making the policies. So we really need to get activated in the state of Ohio. Just to lend to what you were saying, they asked parents who were receiving care in the hospital how many of them felt like they were partners in the care for their child. 15.2% of the people said they felt like they were an active partner in the healthcare decisions for their child. That is horrible. So parents, I mean, is this an issue of bullying? Are they feeling bullied and pressured into accepting care that they don't necessarily feel intuitively is correct for their child? Is the doctor cutting them off after 11 seconds and not taking into consideration, you know, the experiences that they've had with the different products? I don't really know, but that's a very dismal number to me.
I 100% agree. I mean, when you told me that number, I was shocked by it, and the fact that, you know, one, that it's so low and people don't believe that they're actual partner in making their healthcare decisions, but two, that they will actually stand for it, and they're still going through that system. And again, that system is being corrupted on the inside. You know, lobbyists, as you said, and you guys are trying to make a change on that. And it's also amazing that Ohio has such, unfortunately, dismal statistics. I'm from the Northeast, and I know Ohio is technically the Midwest, but it's really unbelievable that parents don't feel empowered at all. And two, not even educated necessarily on the fact that they should be empowered. I mean, you talked about Robert Scott Bell and the radio show, and the show we're trying to do here, which is literally give people some education and tell them to go look for themselves and what they're capable of doing. Because, you know, whether it's the vaccines, as you said, your family was affected by, is people think that they just have to do lock, stock, and barrel whatever they're told, and that study proves that is they're not. They think that they're owned, unfortunately, and that's not true. And really, the message is to give people health freedom, as Robert Scott Bell would say, to make their own decisions, be in control of their own health care and how that actually works. And we have a ton of chiropractors on board watching this, as well as naturopaths and other natural health practitioners. So do me a favor, because I just wanted to do an update with you today, and I really appreciate you jumping on after we got the technology right, is give everyone a little background or a little information on where they can go to help you. Because quite honestly, guys, anybody who's watching this, going to Health Freedom Ohio and the website she's going to give you, it doesn't take a lot for them to get this off the ground and really get them in front of people's faces. So do whatever you can to help them. Michelle, give them the information where they can go find you and help you.
Sure. So our website is healthfreedomohio.org, and our donation button is right there on the home page. What we actually need right now is only, I think we're up to 11 people who are dedicated to donating $25 a month. That's it, just $25 a month. And we can start our annual Wellness Day at the Capitol event. This is how you change things, people. You got to get yourself in front of the legislators and start educating them that there are other alternative pathways to health, because they're not hearing about it. And they don't know, all they know is allopathic pharmaceutical care, because that's, unless you had access to the natural health community, that's all you know. That's all I knew until somebody opened the door for me. So we get it done by showing up and starting to hold events in the Capitol on their turf. And all we need is 11 people, $25 a month. That's it. That's all we need. And we can start scheduling this event right now.
So in all honesty, if we're talking big overall numbers, you guys only need really a couple $1,000s to have this completely done.
Yep.
And you guys are in front of legislative and policy makers. You're on the same level, essentially, as the lobbyists, and you guys can get in front of them. That is so huge. I mean, I don't know if people realize that, but that is to be that small number away. I'm going to jump on there, get mine in there for you guys. But also anybody watching this, please go help Michelle. She is a registered nurse again. She's been impacted by the vaccine issue, her own family, and she is now one of those, I call them super moms out there who are actually going out and you're changing the world. So Michelle, give us any parting words you can, and we're going to do our best to help you.
Well, I know this is a nationwide show, Jason, so I think, my parting message is to encourage other states to do the same. If you have a medical freedom or a health freedom group, get involved with them, donate to their cause. It costs money to make flyers and to educate and to have community awareness events. We can do this together. This is 100% grassroots. This is what it's about. This is how we make a change. So find your local groups in your state and get involved.
Awesome. Thank you so much, Michelle. What we're going to do is we're going to put the link below where people can go actually donate. So again, just following up on this Revolution Health update with Michelle Cotterman, a registered nurse. She is actually just a little bit of money away where they're actually in front of legislative and policy makers on the same level as lobbyists in the state of Ohio, where the medical system is abysmal and people are not getting the care that they deserve, and they don't know that they could be in control. So we're going to help her get this handled. We're going to please share this to everybody so that if I'm sure between all the people watching this now know somebody in Ohio who probably is directly affected by this. We can get that number handled immediately. It's like $24 a month. It's very simple, very easy. Michelle, thank you again so much for the update. I really appreciate it. And comment below, share this out to everybody. And we'll also get this up to YouTube right away, and we'll out to podcast too, so we can actually get it going global. That's the whole point of this. And Michelle, have an amazing day. Keep fighting hard. You have a lot of people behind you.
Thank you so much, Jason. You too.
You're welcome. Revolution Health for a Monday afternoon, you guys. Go take care of Michelle. Go check out all her videos. She's an awesome, knowledgeable woman, and she's going to fight for all your children's health care as well. Have a great day.